For our update today, we have 33 new cases who have tested positive for COVID-19 here in British Columbia, bringing our total to 2,288 people who have tested positive so far. That includes 865 people in the Vancouver Coastal Health Region, 1,064 in the Fraser Health Region, 126 people in the Vancouver Island Health Region, 179 people in Interior Health, and 54 in the Northern Health Region. We continue to have active outbreaks in long-term care, assisted living, and a number of acute care units. There are no new outbreaks. We continue to have 21 active outbreaks in those areas, with an additional 11 cases identified, so that bringing our total to 280 residents or patients and 180 staff affected. 18 of the outbreaks in long-term care or acute care have been declared over. In terms of our community outbreaks that we have been following, there are no change in the number of community outbreaks. We continue to have 7 cases at the Fraser Valley Specialty Poultry, 56 at Superior Poultry, and 35 at United Poultry. 134 cases, the same at the Mission Federal Correctional Institution, and 16 people associated directly with Coral Lake in Alberta. And of course, as we've mentioned, that's an ongoing concern for us and for our colleagues in Alberta. Of the cases here in BC, 76 are currently in hospital, and of those, 20 are in critical care or ICU. We have an additional 2 people who have died from COVID-19 in the last 24 hours, bringing the total number of people who have died to 126 in British Columbia. That includes 1 person in Fraser and 1 in Vancouver Coastal Health, and our condolences go to their families and their loved ones, their communities. We have 1,512 people who have now fully recovered from COVID-19. Yesterday, the Premier outlined our BC Restart Plan, and as lots of information was provided, I assume people may have a few questions. And I know everybody is working hard to put the details behind what we announced yesterday. I will remind people we are now in Phase 1, and we continue to be in Phase 1. And that means we must continue what we are doing for a bit longer. That is important for us. We need to continue the measures that we're taking to bend our curve down and to get this under control. Yesterday, the Premier announced we'll be ready to move to Phase 2 after the May long weekend, so it's not much longer now. This is something we can all look forward to, even if it's not quite here yet. And we will be watching very carefully to make sure that all of that we're doing will continue to make it safe for us to expand. We ask you to please continue to stay at home if you can, as much as possible, and to be respectful of those around you if you do go out. We all have our stories, and we all have our reasons for doing what we're doing, and we need to be understanding of each other through these times. It's still very much a necessity for all of us to continue our safe physical distancing, our washing our hands regularly, avoiding non-essential personal travel, and those things are things that will not change, even when we move to Phase 2 in the coming days. We need to have a slow and thoughtful reset. We do not want to undo all that we have done. And even as we shift into this next phase, not everyone will be ready to increase their social connection or to restart their businesses at the same time. We don't expect that on one day, all of a sudden, everything will be open and back to normal. Just because it's allowed as well doesn't mean that everyone must or should change what they're doing now. Each of us must use the individual principles that we've set out and guide our own actions moving forward. I know some people are looking for very clear direction and rules that everybody must follow, but we recognize that everybody's circumstances are unique. We all have our own experience of this, and we all have our own experience of our households and our families that we need to keep in mind. our health, our work, the people in our physical distancing bubble, determine our personal approach to the next phase of this. All of us need to think about who we are bringing into our bubble, our orbit, as we move into the second phase, and in many cases, we'll be able to increase our bubble. But if you are caring for elders at home, a senior, somebody with a health condition, somebody who's going through cancer treatment, for example, or somebody who's awaiting surgery now that we have started our restart of our surgery programs, your risk has not lessened. And you may want to continue the measures that you're taking now and looking to others to help support you in doing that. You may need to keep your circle quite small in the coming days. So before you go out and meet your friends, think about their family, think about your family. I said this before, our mantra for the next little while is going to be few faces and big spaces. Let's remember to keep our space between us and to be careful and mindful of those who may be more vulnerable in our families, in our communities. That's the only way that we can continue to keep transmission low and keep it under control so that we can restart in an effective way. For businesses, we are working public health with WorkSafe BC, and we're going to outline the specific requirements. We're working with many different industry and sector associations, so we're going to have those details for you to be followed for your business sector and your workforce. Template plans and checklists will be available, and they're being developed even as we speak. We started on this some time ago, but it takes a bit of time. So the basic principles that we outlined yesterday and that I've outlined a number of times will apply across all sectors. So businesses will need to make decisions for themselves, however, based on your ability to meet those requirements. So some restaurants and bars, for example, some hair salons, they may not open. Like every family, every business is also unique and depends on who works there, who you serve, who your clientele are, and the physical setup of your business. So it may be gradual for some. It may be not an effective business proposition for others. So we do not expect that everybody must follow the same plan. It will depend on your own business, the people who work, your employees, and making sure that they stay safe, and the people who use your business are able to be safe. Individual plans for every business that will be opening do not need to be submitted for approval, but you do need to ensure that your plan is publicly posted, and this is how we have accountability to each other and how we can ensure that everybody understands the measures you're taking to keep your employees safe and to keep customers safe. And that's the way that we can build confidence together, that we are taking the appropriate measures that we all need to do to make sure that we can kickstart our economy and that we can have confidence that we're doing all we can to protect each other in this next phase. Of course, underpinning much of our next phase is restarting our health system, and we're taking a whole of healthcare approach for that as well. And as the Minister and Premier outlined earlier today, a surgery renewal plan has been launched to address that very important backlog of scheduled or elective surgeries and the people who have been most affected by those over the past few months. But we need to maintain our surge capacity within our health system to make sure that we can deal with people who have COVID-19 over the coming weeks and months and do it safely for everybody so that the surgeries can ramp up and people can get all of the care that they need in a safe way. And part of that, of course, is what we do in public health to continue to monitor, to continue to test, and our testing strategy allows for anyone who has symptoms in BC of COVID-19, even the mildest symptoms, to be able to get a test for this. As well, we have public health teams that will continue to be on high alert, monitoring and contact tracing anybody who develops COVID-19. And this, of course, works best and is most efficient and is able to protect us all when we keep our circles small. And that, again, comes back to your choices and your decisions around expanding your circle in a limited way in the coming weeks and months. All we do together helps us manage this so that we can get on with those social connections and the economic engines that we need to keep going. Then it's also about delivering care in the safest possible way to all of us who need it in the system. So like everybody around the world, each day COVID-19 brings new challenges, but also new learnings, and we will adjust in the coming weeks and months as we learn. We're learning as much as we can so that we are prepared for what may come in the fall, and I've talked about this many times, about our concern that we may have a resurgence in the respiratory season in the fall. We know that we will have influenza in the fall, so we're planning now for how can we best maintain our systems, how can we strategize to reduce the impact of influenza and to monitor very carefully for COVID-19. So let's continue to stand together in our pandemic, at least in spirit, while staying apart. The future is in our hands, and we must continue to wash them and continue as well to be kind and to be calm and to be safe.